Hello, hello, hello. Welcome to this new edition of Mind Podcast. This is Adit Kapadia. Welcome on this very bleak Monday. I say, abhi aajkal kuch bhi, there is nothing very spectacular about this world anyways. But we are going to start, we're going to do it differently this time. We will talk about the bad news. We will talk about what's going on in the world. But I'll go ahead and start with the good news first after I introduce my panelists. So let me introduce my panelist, columnist, founder of the Shaktitva project, dear friend, and Neha Srivastava. Hi, Neha.
Hi, thank you so much for having me. I'm always happy to be a part of Mind podcasts.
Absolutely, and it's great to have you back. So I said I'll start with a bit of good news, right? So the people that have recovered from the coronavirus, that number crossed 160,000 today. We have total
Fantastic.
160,000, 164,700-ish people by the time we were recording the podcast. So, I mean, 24 घंटे बाद अगर 2 लाख हो जाए तो मुझे मत बोलना कि अरे you didn't tell the correct figures. So I must say,
How dare you?
how dare I? Yes. But of course, the grim reality is that there have been 37,600 people that have died, unfortunately, and more than 500,000 active cases. So our prayers go out to all the people suffering, all the people who are helping them through the suffering, families, doctors, nurses. हम लोग तो यहाँ बैठ के analysis करते हैं. We are staying in our quarantine and stuff. But, hats off to them for what they're doing. But
Absolutely.
but Neha, you join us from an interesting place. It is the epicenter of the coronavirus pandemic in United States. I mean, no doubt about that. New York City, especially in New Jersey, have been hit quite a bit. Uh, More than 40% of the cases are there in New York State alone. And if you add Jersey, I think that number is very close to 50%. But that number might change because a lot more states are reporting cases now in the United States, and we can now say that United States, between US and Italy, there's a difference of almost 50,000 cases now. So the most number of sort of patients will probably be found in United States unless we find out something else. So Neha, before I go into all
Yeah.
the
But I think
no, I want to come to you first about New York. Give me your sense of what you've seen in the last 2 weeks, 3 weeks.
so. First of all, we have to understand when we mention that New York, like we are comparing numbers between Italy and USA. We need to be like a little cognizant of the fact that Italy is like a very small part, like a small the population in Italy is much smaller than the population in USA. It's probably like at least 1/6 of USA's population. So we should be like there. We should probably talk about per capita numbers better. Would give us a better sense rather than a
Absolutely.
entire like
That I was
absolute
no no.
number comparison.
Yeah,
And that is
that I was going to come to later because no question
yeah.
the fatality rate in Italy is significantly higher. It's almost 10%. But I'm saying just in terms of New York City, what is it going through right
So this was has been an interesting journey for the past 3 weeks. I was interestingly because of China and because China is like literally next door to India. I was very scared way before this happened in US in any reasonable way. So I've been following the news updates and whatever. And I already by the time the first case in New York was revealed, I already knew that I knew certain things that were happening. Number one was that this is a brand new virus. We don't know anything about it. We don't know how to cure it. Then the confirmation came about human to human transmission also. And then we knew that it's not affecting only the host that has directly come in contact with the virus, but also transmitting through contact. And then we learned that it was transmitting through aerosolized like it was airborne as well.
now?
So all of that information was making it, even the picture was becoming grimmer and grimmer. And then I learned that the first case was found in Grand Central.
Which is
Grand Central happens to be the
please
yeah
elaborate.
Grand Central happens to be the hub of all commute into New York and out of New York. You have not only the local subway trains that pass through through Grand Central, you also have Long Island Railroad, you have NJ Transit, and you have Amtrak trains going to different parts of the country. So all the possible train systems could, like, converge at Grand Central. It is grand for a reason. Incidentally, it also happens to be the train station that I get off at for work. So I was like in full panic mode. And by chance, like, I came back from India in January, so I was already sick. Like, I had like an entire bout of flu right after I came down. So all of that combined, I was like full panic mode. And I decided to work from home for a couple of days. My manager and like company was very, very understanding, but I didn't see that sense of urgency, not just in like not my company, but in New York at all. So the first case happened, and I think like roughly 4 or 5 days passed, and no sense of urgency came from the administration or from ordinary people. It was like, it's a flu, maybe it's not true, or it won't hurt us. I don't exactly know what was going on in their minds.
Let me pause you there for 1 second, because I think you've raised a very important point. That a lot of the narrative in the American media seems to be that, oh, the White House wasn't serious about it, which may be true, right? But neither was the governor of New York in the first week of when it could have been
Not
stopped.
even the mayor of New York. Forget the governor, like mayor of New York City. New York City is one of the busiest ports within the New York state, and it connects to several other states as well. Connecticut is very tightly connected. New Jersey is very tightly connected. So New York City is the hub of not just New York, but also the tri-state area. And nobody seemed as concerned, at least for a week and a half, as if like people were, I don't know what people were expecting. Then you had this was the first case in Grand Central. Then immediately we learned, within 3 4 days we learned that there was a super spreader living in Westchester who got the virus from Grand Central again. So he was a lawyer. um, Initially people thought, oh, maybe he's an immigration lawyer, so he came in contact with some people who had flown down or something. He was not an immigration lawyer, not that I know of. He incidentally contracted the disease, so it was community spread. He had no travel history, and then he spread it to all his family in Westchester, but he used to commute directly from Grand Central. And that was the first super spreader case, to the point that his children's schools were quarantined in Westchester. Yet Grand Central was happily, servicing all the people, or millions and billions of people that pass through it every day.
At
At
this
least like thousands of people.
at
Yeah.
this point, on a lighter note, I had the special effects of Ekta Kapoor's cameraman and would do like a 3 time, because people need to understand this. Like, ये ऐसे नहीं हुआ कि न्यूयॉर्क में just एक दिन फूट गया and then everyone's like suddenly realized this. These are serious lapses, and whatever Democrats might want to say, oh, people need to invest in healthcare or something. Yes, but they might also have to invest in common sense.
Yes, absolutely. No question there. In fact, like I remember, abhi recently I saw a tweet from Bill de Blasio from March 2nd, not even like February. We're talking February timelines. In March 2nd, he is recommending that people should go out and have fun, and he's recommending a movie for people to watch in theaters.
Wow.
So this was I mean, like, this, I don't really know. Maybe it's like American exceptionalism that, this won't touch us, or what exactly is the psychological profile? I don't understand. There was another thing that kind of stuck out for me, was that despite the number of when the cases started growing at an alarming rate, even then the administration was not sure whether they should shut down schools or not. Now I am not like, I completely understand what the pros and cons of this debate were, right? If you were in a similar position, you would have to weigh the outcomes of the economic impact, as well as the fact that schools in New York are actually also double up as daycare centers. So daily wage laborers, or people who have a daily hourly basis jobs, they put their kids in daycare, and only
A
then
lot
they
of
can
people
go.
cannot work from home. They are not as lucky as you and
Exactly.
I are.
Exactly. And in fact, like, it's not just about work from home either. Like, in fact, even with work from home, if the children are at home, then it's hard to even work from home, right?
Yeah, well, I
So
mean,
this New
I,
York's schools double up as daycare centers. And so they were worried about that. I completely get it. Like they were, hesitating in closing down schools. But I think the cost, the analysis to decide whether or not this is is this a worthy investment took too long, in my opinion. It should have been done much faster.
I I agree with you, and I think the main issue here is threefold, right? First is, could it have been prevented? And you cannot say that, "Arey, completely prevention ho sakta tha." No, but the scale could have been a lot lesser. Because right now, honestly, to somebody who's not in New York, and you can correct me if I'm wrong, it looks like New York is almost Ram Bharose right now. That we're just hoping. Uh,
Absolutely right. In fact, I recently shared a thread on Twitter, and I was getting inundated once the first Kanika Kapoor case happened in India, and the scare happened. All sorts of people are, look at US, look at US, and I'm like, what are you talking about? Right? I am sitting in US, and what are you talking about? So I look, like, I literally posted a picture outside my window, and there were around 50 cars parked in front of a shopping complex in after at least 2 weeks or 1 week after the lockdown was announced.
Unbelievable.
Bill de Blasio had no concept of, he was very, very lethargic on this matter.
Hmm.
Andrew Cuomo, by the time he made a decision, and actually New Jersey did a lockdown long before New York did it.
Hmm.
And the essential business shutdown happened in Jersey City much far sooner than it happened in New York. And even when you did it in New York, incidentally, one tidbit here that he somehow recognized liquor shops as essential businesses.
Goodness gracious.
I don't know. I really don't understand the priorities here, but okay, sure. So they had but the people
I will
even
give an
after.
example of what happened in India today when we talk about India, because Kerala में कुछ ऐसा ही आज हुआ है. So finish your point, Neha. Though. Yeah.
Yeah, so we had this even after the lockdown was announced, there was very little awareness, right? And very little understanding of what was going on. And on top of that, people were taking it too lightly. I even read reports where people were organizing Corona parties. Of all things, yes, this was like it is like, I think it's a mental disease. So the youngsters were organizing Corona parties where not only where they were obviously not practicing any social distancing. In fact, they were coughing at older people passing down the street.
So not only is that insensitive, insane, and completely ridiculous, and tells you how. I mean, I saw clips of people in Florida on Spring Beach doing, I mean, on spring break doing nonsense. And look at the state of Miami right now. Miami
Yeah.
might be one of the cities worst affected by thing outside the tri-state area. But I was, so to complete what I was saying. So that's the first point. The other 2 points about New York and Jersey, what struck me was that the complete sort of lack of understanding in the rest of America about what New York and Jersey were going through when they were going through. Because you
Yes.
did not see that fear translating into the other parts of US. And the third thing was um, sort of a वो looking London talking Tokyo, वो जो है ना वो हो रहा था कि the statements in DC were doing one thing, but the
Yep.
mayors and local establishment were on a completely different tangent. And
Yes.
that dichotomy is what sort of hit. So when you have a complete lockdown being announced in India, in spite of a lot fewer cases than America, even if you count it by per million population, because India has 1.4 times the population of US. That was because they sort of knew that we don't want to get into this. And in India, it is going to, once if it gets into tier 2 cities and smaller cities, it just gets very, very hard to
Yes.
maintain. So but we're going to come to India later. So Neha, what do you like, what do you reckon, like what went wrong? What's the way forward, and is there a way forward?
I think at this point we have crossed that minimum threshold. We are not even at the peak at New York yet. And because this virus remains asymptomatic for 2 weeks, probably a lot more people are infected than we even know. The only people that we are counting and testing are the ones who are showing some symptoms. and the ones that are getting hospitalized. So there may be several people who are self quarantining or who are not showing symptoms yet, who may already be infected. Because again, see, this was there was a very nice graphic that was shown on that was being shared on social media, where if you break the chain, the spread of the virus gets arrested by 50 to 60%.
Right.
So if one person reaches out to 10 people every day, those 10 people infect another 10 people every day, right? So
Right.
one carrier can quickly spreads around 400 people in 5 days.
Wow.
So that, and then also remember that in this entire 5-day period, none of them will be showing symptoms. So you have no idea that you've been infected, which is why social distancing early and quick and fast and almost at a ruthless pace was the only thing you could have possibly done to do prevention. At this point, we have crossed that. If you're talking about 100,000 cases, and these are 60,000 cases in New York that we know of, you can easily assume that at least that number is at least 100,000.
Yes.
Um, uh,
You look at the numbers, they are daily increasing by 7 to 8,000 or 6 to 7,000. And if you extrapolate that in about 7 days, you're going to cross 100,000 cases. And there is no, and we
a
haven't.
lot of people are talking about testing.
Yeah.
A lot of people are talking repeatedly about testing. At this scale, testing is irrelevant. Really, what is testing achieving except giving you the numbers? It's not helping at all. It's using a certain kit, and it's taking up a lot of time. And in fact, I read that California and New York are considering not testing people, because they have to save the kits to test those who need it the most, which is the healthcare workers, to make sure that they are protected. Because at this point, the spread has crossed that threshold where the numbers matter, right? We have
And
the slope is out of that.
yeah, I've heard unconfirmed reports that in Texas too, there is lack of testing kits and stuff. I don't think the numbers
Yeah.
you're seeing from Texas, I'm sitting in Texas right now, there is no, this is a, I mean, and I'm not saying they're reporting false numbers. I just don't think they haven't tested enough, because there aren't many
But
tests.
what is testing? But if you think from a
Yeah,
public health point, testing is not going to achieve anything anymore in US,
just
because
makes for, and I hate to use this word, but it just makes for sexy headlines. That's it.
yeah, that's all. Because at this time, we have crossed that threshold. If you look at the US chart, it is completely out of control for every other country. Another very important reason why I think New York was worst hit is because we have three airports: Newark, JFK, and LaGuardia, all of whom receive international flights, and those airports were the least controlled places ever.
Oh,
India started doing travel restrictions a lot sooner than New York even did.
this came from India. I have seen, and Houston wasn't that affected, so I won't expect that thing. But I have heard of people who have just come to India, just come from India in the last 10 days, and the checking is not where it's supposed to be. In fact, they were checked more when they were leaving India, and that is
Yes.
incredible. And not just that, New York also has a lot of flights from Italy. So you had a lot of people coming in from Italy, a lot of people coming in from China. So I don't know whether that's how it came, but obviously that's how, I mean, the spread, it didn't originate in New York. So it has to have
Right.
come from somewhere, right?
And I think there's one more important point to discuss here. A lot of things a lot of times when people think of New York and when they think of the West and they think of the state of the medicine, there is this, subtle perception that, everybody is rich, everybody has a lot of money, all the, medical equipments are top of the line, and everybody gets top class treatment, versus wherever we are, we tend to, put those countries down, and we compare the West as this epitome of success and technological development. So there has been this conception that this is an elite's disease. I've seen that phrase occur several places
I,
across social
yeah,
media.
yeah, they are the peace nuts of social media and American media.
Not just American media, actually, I'm seeing this phrase occurs in several different places, in several different communities,
Global peace
where
nuts, let's put it that way.
where people, where people are assuming that this disease is only affecting those who can afford foreign travel. and therefore it is only hanging out in the upper elite social strata and not affecting the poorer people. But
Yes.
if you look at the New York numbers, the numbers tell a very different story. Let's assume, even first of all, this definition itself, that people who are rich can only are the only ones who can afford foreign travel, does not hold true for New York. But because New York is a hub of immigrants, and a lot of these immigrants save money on a daily basis so that they can afford travel to their home country once a year. So that idea that only the rich can afford foreign travel does not hold true for countries that are heavy on immigrants, especially in areas where immigrant population is a lot higher, which is such as New York. Second thing is, let's assume that it was only affecting a small sliver of the population that was flying from outside. But the spread has now crossed that.
Right.
The spread has now, and who did it affect, right? The people who could self isolate, privileged people like me and you, who could afford to do work from home, who had who had jobs that allowed them to do work from home.
Right.
They protected themselves and their families early on. The only ones who were forced to go to their daily jobs because they are paid on an hourly basis, or they had to go to their jobs where they would lose if they don't show up for work one day, those are the kind of people who were most susceptible. And the numbers in New York now make it clear that the community spread has reached those populations. So
And
now,
I'll add something to that also. Even among the people who could work from home, there are a lot of people who did not work from home
yes,
because like kya hone wala hai, right? So
yes,
that also is like, you have to be prudent about this, guys. We cannot, and I'm, pardon my language, but we cannot be moronic or idiotic about this, because
yes. But the reason I was mentioning that other point was because a lot of people are saying this is elite's disease, right? So it's not going to come to our home. But think about it, these same elites, they also shop, whoever those supposed elites are, they also shop in the same grocery stores, in the same medical shops, they go to the same joints, and all of the people working in those grocery stores and those medical shops are the ones who are paid on an hourly basis, who cannot afford to work from home or not show up to work in order to protect themselves to social distancing.
but
This is where government initiatives become extremely important, right? This is where the point, this spread from whoever was the carrier bringing in it from foreign countries, say, let's say that was population A, controlling the spread from population A to population B, which cannot afford to do self quarantine, was the job of the government. Controlling that spread, that transfer, and that is where the government of New York completely failed.
So when we talk about government, we are also going to talk about WHO. I just wrote a piece. I was so angry
Oh,
at WHO. So we'll talk about that
yeah.
a little later. And for people who do not know who P. Sainath is, go read what Manu Joseph has to say about P. Sainath first, and then read P. Sainath. And I'm guaranteeing you, every single thing that Manu has said about P. Sainath is absolutely hilarious. And I have disagreements with both of them on many things, but do read that.
Yes.
So moving to India, right? In India, it's a completely different situation. So in India,
Yes.
the lockdown has happened. There is some spread. Thanks to the Tablighi Jamaat, what was about increasing in 100 now has increased in 200s today, because of the
Yeah.
Tablighi Jamaat conference that happened in Delhi, and 150 people are, I think, quarantined in the Hazrat Nizamuddin area, or 150 or maybe more. And I forget, some Prakash from, it's not Smita Prakash, but the other Prakash from ANI actually put it very nicely, that you feel bad for the medical professionals who have to go and attend to these people, because these idiots did not use their brains and actually went for the conference in spite of the lockdown measures in place. Now,
I am not I am more worried about the police,
how much of
medical profession.
yeah,
Yeah.
there is a whole system that has to look after them, na? So let's start with what happened in India. So about 5 days ago, Prime Minister Narendra Modi announced the lockdown. Since then, the essential services have been available. There have been a few hiccups, let's not deny that, in grocery availability and stuff like that, because there was some miscommunication. I think that is being solved, but ultimately, for the greater, I mean, I hate to use this phrase, but for the greater safety of the community, this had to be done. I mean, you have
See, this is where it's very, very important. That's why I think we spent a good amount of time looking at New York, and this is where this scenario should be compared against India. And incidentally, two things happened back on back. First, this nightmare at Grand Central that unfolded in my life, and the second thing happened. Kanika Kapoor went and started spreading the virus in my neighbor. Literally, the neighborhood she was living in was 300 meters away from my ancestral home.
you can
So
you
she gave me a
you
heart
can
attack.
understand why one of another reasons why Neha is on the podcast is she works in the same building where the spread was happening in New York, and one of the biggest stories that happened in Lucknow, and right now in UP, she's from that place. So you are at
Yes.
the strange intersectionality of that
Yes.
sort of weird. I'm not sure that's a place you want to be. I'm pretty sure that's a place you don't want to be.
Absolutely. So if you think about it, Adit, the first super spreader, the office of the first super spreader was probably less than half a kilometer away from my office. And the first super spreader in India,
Well,
Kanika
potential
Kapoor,
super spreader, because
potential
no
super,
one, because we
sorry,
don't know.
potential super spreader or a super spreader scare that we got in India, which was Kanika Kapoor, was half a kilometer away from my ancestral home in India. So I had like two giant scares, but I can compare but it puts me in a unique position where I can compare the responses. So I told you, like, when the Grand Central case happened, like, people were like roaming around and going to carts, and as if like nothing has happened, everything is cool. Up even after the lockdown was announced, nothing was, people were roaming in Central Park. There were images coming from DC where people were going to see the cherry blossom festival. It is
Good God.
yes, we actually, there was
For
pictures of
those on audio, I wish you could see how my eyes almost popped out of their sockets. Because cherry
so
blossom is in a very small area. You cannot
yes.
be socially distant even if you wanted to.
Yes. So you have to like, I think like the recommended distance is around 6 feet between people, and the real distance in Cherry Blossom Festival is barely like half a foot.
I mean, I
So
was
that
6 inches. So
yeah. So that happened. But if you compare that with the Kanika Kapoor case, now I'll tell you the timeline of this is how happened. I woke up in the morning, I checked Twitter and from my bed, and I saw Kanika Kapoor spreads coronavirus in Lucknow. So I get, by the time I click on the news article to read the details, I'm thinking in my head, okay, maybe this is in one of those posh parts of Lucknow, and maybe it wouldn't be near my family. And now it's going on in my head. It's like, okay, there are two relatives who live in that posh part, but the likelihood of them interacting with Kanikapu, they don't have like the same social circles, so maybe they'll be safe. Then I click on it, and she is like 300 kilometers away from my ancestral home. And
300,
I'm like, of
300
all
meters,
the,
you mean?
sorry?
300 meters, you
Oh,
mean?
300
Because
meters, yeah, walking distance, yes. So I'm looking at it, it's like, of all the freaking buildings in Lucknow, you had to live in that one. and let me paint a picture of this as if it's not clear enough. My ancestral home is one of the older parts of Lucknow, so it's not a planned area, it's not a very well planned area, it's a haphazard tier 2 city area. And that building is one of the posher buildings that has come up, the front of which opens in a relatively nicer area with parks and such, and the back of it opens in a market. And that market is the kind of market where if you are carrying too many bags in your hands, you might have to tilt yourself to pass through the space that is available. It is one of those markets where your shoulders rub against the people
possibly
who are passing.
impossible to have I mean, distancing.
Yeah, this is not a place. Forget social distancing. No kind of distancing is possible here. Cars cannot pass on those roads.
Yeah,
This is the kind of
I'm
That is,
familiar what you're talking about, because in Ahmedabad there is an old city, walled city area. The old city is very similar, where there is
yeah.
barely any space between the markets and stuff.
Yeah, so this is called Dandaya Bazaar, and it is blocked. It is like a very long road that is on both ends. There is a two giant roads that pass through it. So it's like an intersection of sorts. And that building where Kanika Kapoor was opens here. So the chances that her maid comes over here, that her household workers shop from those markets is extremely high. Even let's assume that if her family were too posh to venture in those markets, her at least the in her vicinity, whichever were the
The
workers were
same
going.
sort of reaction. Yeah.
On top of that, then I read that she also went to two beauty parlors, because why not? Because why won't you let the person touch your face and do a facial? Right? It's like, why not? Like, I'm not like, okay. And then she goes to the some Kaya clinic or whatever and spends 2 hours there, and then she goes to three parties. And the only reason we found out the detailed history was because she also hung out with all the posh and elite people who were scared. Otherwise we probably wouldn't have found out, at least the ordinary people wouldn't have found out these details.
But again,
So I am, yeah,
I want to stress a point here, that here it is very possible for you to be a super spreader just by being an idiot and not
yes.
following this. And that's what scares me a lot about India. So moving a little bit forward from Kanika Kapoor to what we have seen in India right now,
No,
that
no, no. I want to clarify one point here.
please.
Once this Kanika Kapoor thing happened, and I read this, my heart is like going out of the world, because I grew up in a joint family, and so there are at least 5 or 6 families in the same building where my house is, and we are, and he or she is like 300 meters away from my family. And I'm thinking of all my nieces, and I'm thinking of all the old people who have diseases that whose immunity is low, and I'm freaking out big time. So I have, like, I start calling whoever will pick up my phone in that entire in my family. And then I call them up, and I'm probably more freaked out than they are. And I was like, what is happening? And then they're like, Neha, don't worry. They have, what before Twitter or anything, I found anything on Twitter, this was what they told me, that they have imposed a curfew on the entire area. We are not allowed to step out of the house. Like, this was not your regular array 144 laga hua hai wala curfew. This was like a real curfew, military level curfew, where if you were found roaming on the loitering on the streets, the police wala will chase you down and ask you, why are you out? So that level curfew was there. The government started announcing through that, those loudspeaker thingies, that you have to stay inside your homes because we are doing something, like whatever details they were giving out at the time. And then they started, then I heard later in the evening, I heard that they had sanitized the entire roads. And imagine the market I'm talking about. This is a market where at least 100 to 200 vendors sit on a daily basis. These are farmers who come from their farms and sell their own vegetables. Like, they set up on the ground and in the thela, and they sell their vegetables. This is the area they sanitized for hours. And after that, they deployed thermal scanners. I couldn't believe my ears. Like, they employed thermal scanners because they were not sure that people would be self-reporting that they are experiencing symptoms.
So
So
this is
they actually,
the proactiveness that Neha was talking about, that she saw.
yes. And if you compare this with New York, and I'm like, what?
Just that, I would like to add, in Ahmedabad, in Bangalore, in Chennai, a lot of places, people from outside of India have come, and a municipal corporation actually has gone to their address wherever they stayed. They're going. They'll ask them, they'll take the temperature and everything. They'll give them a kit with hand sanitizer, wipes, and stuff like that, and said that if you run out in 3 days, give us a call. We'll come back and refill the kit. Please
Yes.
stay here. Please stay quarantined. They will put a letter saying this person has to be quarantined in case that person has tested positive for COVID. So this is,
So one case of not Karina Kapoor, that other Kapoor, Kanika Kapoor, one case for her, and then I later on learned that they had actually put 5 mile radius in a curfew. It
wow.
was not just that one market that they had shut down. They had put like the radius that I know, because I'm from Lucknow, the radius was very vast, and there were at least Three major markets that were shut down because of that, and several smaller markets.
And again, the reason why they are, because एक बार ये अगर फैल जाता तो the way India is, it would be very difficult. I mean,
Absolutely.
of course, it has affected the daily laborers. It has affected daily wage earners. The government has announced a package, a relief package. There are state governments that are feeding them on a daily basis, taking care of them. Yet you have seen scenes near the Delhi-UP border which are quite disturbing.
Yeah.
Unfortunately, you have international agencies like CNN who still cannot do math, who says that 74 million people are there and they call it 1/6 of India's population. I don't know where that logic comes from. But regardless, even if it's 1, 10,000, or 7 million, it's a tragedy. The real question is misinformation. Why is there misinformation being circulated? I cannot tell you. Some of my cousins who's there that have household helps, they tell me that on WhatsApp, absolute rubbish and fear mongering is circulated. Fear mongering stuff is circulated, and they are actually taking this stuff from the cities where they potentially could be affected to villages that have been insulated. So that proves to be a huge danger and a nightmare, healthcare nightmare. So what
I
are your
think you touched on several points, and we need to elaborate on a couple of them. So first very important point you made was that once it has spread, it gets out of control, and nothing can be a better example than New York right now,
right?
right? If you look at the timeline of this, the dilly dallying or the lethargy that we're talking about, it's not like they were wasting months or something. This all of this unfolded in front of our eyes in the last 3 weeks. It was just a delay of 3 weeks, right? And given the history that we have seen of proactiveness of governments, 3 weeks is nothing. 3 weeks is a sneeze. 3 weeks is the time they think of drafting a proposal. Right? Or even thinking about drafting a proposal is the time you have 3 weeks. Yeah, and then you draft a proposal, then it goes to multiple layers of bureaucracy, then it goes to the government, and then it goes, and then several rounds of debates happen, which can take up to years. So in public policy timelines, the 3 weeks is nothing, right? But in that 3 weeks, just because the government was delayed and it was relatively proactive as compared to other states, even then, in just because we were delayed by 3 weeks, we are seeing 60,000 cases just in New York. Yesterday, one of my friends shared a statistic which was mind boggling. The number of deaths that happened in New York City yesterday it can roughly be said that one person died every 5 minutes. Process that, right? One person was dying in New York City, not the state. New York City, one city in the entire country, one person was dying every 5 minutes. And then people on social media, they show up with array statistics wise the fatality rate is only 0.2% or whatever. Like, how can you hide behind statistics? Look at the number of, and who is dying is also important. This is not just random 0.2%, right? This is the most vulnerable population that you're basically condemning to death because you're too stupid to actually stay at home. So you took an unnecessary risk, you went out and you exposed yourself. Yes, you are fit and fine, and you are healthy, you may actually come back and recover from this. But what about your grandmother, your mother, all these people who are above 60, who have other comorbidity diseases, and especially in Indian populations, think about the number of old people who have diabetes. Diabetes is one of those comorbidities, diseases that are people are said to be at high risk. Then you have heart issues. If you combine diabetes and heart issue patients,
Lack of immunity, if when you across a certain age, your
yeah,
immune doesn't fight back the same way like you did when you're 25.
yes. So who are you condemning? Because you at 25 years of age are fit and fine and you're too stupid. You went out and had a corona freaking party, and then you came back and you condemned your grandmother to death.
Yeah,
that
absolutely.
is the that is the risk factor that a lot of people are not understanding. And it's not a disease like plague where you go out and you come back and immediately either you're sick or dead. That's not what's happening here, right? Like, you can be not asymptomatic carrier for 2 weeks. That's what makes this disease so dangerous. So yesterday we had these visuals, in the past 2 days, this weekend was harrowing for me, because yet another massive nightmare unfolded in Lucknow, in the UP Delhi border, as you mentioned. And we saw visuals of thousands of people being dumped on the highway at the UP border. And all of these are poor migrant laborers, right? Now, people said, what is there to be worried about? It's not like they were hanging with foreign return people, right? But again, people don't understand how community spread works. Already they found one case in Delhi which was from a mohalla clinic.
Yeah.
Mohalla clinic does not cater to high flyers.
Metro. How do you know? I mean, there is just no way of knowing.
Yeah. And then if you think about the population that comes to North India from Middle Eastern countries, where also the spread is pretty high. So you have that is not the high flyer rich elite population. That is the
That's how
regular
it
population.
happened in Kerala. In Kerala, a lot of people who've come from the Middle East, and things happened. Maybe from other countries too, from China also. I think one of the ministers came from China and got the virus. So
Yeah, and these are so a minister is a different social class, right? But the people who are coming back from Middle East are the lower to middle income class. They are not the high flyer elites like Kanika Kapoor.
huh,
So it's just because you don't hang out with Kanika Kapoor as people does not mean you are insulated. Because now we are seeing spread coming into lower socioeconomic statuses. Then you saw a case in Mohalla clinics where one patient gave it to the doctor and the doctor gave it to hundreds more people,
it's unbelievable.
right? So you saw this happen in albeit it was controlled, agreed. It didn't go out of hand, or maybe we don't know if it went out of hand, but whatever may be the scenario, we had at least a small cluster that happened in Delhi. They tested everybody around the person, and figured out ways to control it. But now this is one mohalla in Delhi, right? If you think about the scale of this is ridiculous. Some of those laborers who are returning now could have visited that same mohalla. They may be asymptomatic carriers. Just because they're hanging around in such large groups, they could be spreading it to other people. Now these same migrants will go back to their villages and then give it to their village people. And now this is where it becomes very, very scary. And this is exactly why what you said was absolutely true, that while it was difficult, right, it was economically difficult, no question. That again, we are not people who worry about our daily bread, but there are people who have to earn daily in order to eat,
Yeah.
right? I agree that any kind of economic lockdown is causing a lot of problems for those people, and the government is trying their best and struggling. Of course, India is not perfect,
Right.
but the government is trying their best. The UP has announced 1,000 rupees subsidy for the daily wage population, like the daily wage laborers. The government is going to provide supplemental income. They are also announcing free rationing. They are announcing free medicines to the extent possible. By the way, New York, another important comparison here, that a lot of articles that are writing people, that a lot of authors that are writing such articles are forgetting, is that in New York, testing was not free. A lot of people who suspected that they could have been exposed did not go to the hospitals because they were worried how would they pay for the testing, because they didn't have insurance.
So that
In
happens as
India,
well. It's free.
yes, in India, every single test is free.
Absolutely, that's phenomenal.
Right?
And then tomorrow, I think City of Sugarland, where I am based, they're also doing free testing. But we are getting slowly to the end of the podcast. So finish your point, and then I'm going to come to final points. Yeah.
So finally, one I'd say, and there's a lot of arguments being made that India is not testing enough, right? So again, you have to understand how a country like India can figure out whether community spread is happening or not. This is physically impossible to test 1 billion people,
Yeah.
right? It will take ages.
Yeah.
By the time, like, the next disease would have come, by the time we will finish testing every single person. So the way the statistical model that is being deployed is very, very intelligent model. First, they are identifying first level carriers, and they're testing everybody in their vicinity. So they're testing those clusters, as we call it, and then they are doing random cluster testing. So what they're saying is, if the disease is spreading, we know the rate of spread. If the disease is spreading, then random clusters with that we had not identified as having been connected to somebody with a travel history or at risk would also show us some positive cases.
And
But none of those random tests, the random clusters have shown any tests.
and this is not to say that it's not happening. When you have a stupidity, the inadvertent stupidity, there is also the stupidity where this 1,500 people went to Delhi for this Tablighi Jamaat thing, and 200 people have tested positive. So that is insanity, and that should be avoided. Doesn't matter religion, community, wedding event, कोई भी event हो, ऐसा पागलपन मत करो. I got this wonderful meme which said that you have one job, to sit home and watch TV. Do not screw it up. You just have to
No, to watch Netflix and save the world. Yes, that was the meme.
Netflix and save the world. It's completely crazy. We have a lot more to discuss in India. What's happening? We'll have Neha again to discuss more. This is not going to be resolved soon, anytime soon. But one thing we can make sure is India is doing the best it can in terms of with the limited resources it has. Can it be better? Obviously,
No, no. It is actually doing better than countries with better resources.
what I'm saying. So can it be better? Obviously, but is it doing better than a lot of countries with resources? Absolutely. And I just hope and pray that all of you guys, stay home, stay safe. Let us know. Write to us. What is your thing? Before you go, I have to add this, and we'll come to recommendations. Okay, the WHO's conduct has been absolutely appalling. They have been a Chinese. I mean, I don't want to say the entire WHO because there are some people doing great work, but Dr. Tedros and his a bunch of merry men. I mean, there was this clip where the guy was asked about Taiwan and he just walked away from the debate in the most weird fashion ever. Dr.
No. I have to tell you something fun. They published a report, not WHO, but the Lancet. Lancet is a very reputed science journal.
Yes.
They published a report saying that any travel restrictions against people of China is racist.
And any unbelievable.
This was published in February.
In January 14th, WHO said preliminary things indicate that there is no issue. Now, if you are going off Chinese officials' reports and if it was not reliable, you should have said that this report is not reliable. And if you find the findings of Chinese officials reliable, then you absolutely should be fired because you don't have the concept of discerning between what is data and what is propaganda. And clearly, the guy who's leading WHO, Dr. Tedros, there are numerous allegations of how he was, elected, and there are many disturbing sort of conflicts of interest. I mean, I know that countries are not taking on because the workers of WHO are doing a stunning job. But it is a need of the hour that the world needs to step in, and the credibility of WHO, World Health Organization, has to be restored. This is simply not done. They've dropped the ball and massively. So I'm doing a shameless plug, but do read my piece. I've actually given some instances on that. And in about 24 hours, Mind is also going to publish a piece which actually, with references, which completely rebuts what, the stands that they've taken now and what they have said before. So do read that. But before I let you go, Neha, we have people who are staying home. We have to give them recommendations. So what's your recommendation to watch, read, share for people?
So read, actually, I have not advanced copy, but this book just came out. Firekeepers of Jwalapuram by Vamsi Juluri. It's the second of the Kishkinda Chronicles. I am deeply engrossed in this right now. So it was literally sitting on my desk. I did not prepare for it beforehand. But it's been amazing. I really loved the story. I loved the first part, and we patiently waited for years for the second part to come back. So that's the other one. In a TV shows, I am I like a cop show fan of sorts. But I took a break a little bit, and I landed on something called Outlander. It's a Stars TV show. It's very unique. It's in its storyline, and it basically goes around about a woman who accidentally touches one of the stores with one of the stones where the erstwhile witches used to practice their they had the ritual they show is very similar to the like it's like a Sankranti event. They
Ah,
don't have a bonfire necessarily, but they have people dancing around a fire, and it's in a circular
like a
manner.
lorry almost.
And it's on Samayan Day, which is again the equinox. So it's very similar to that. But this lady, she randomly lands up there, and she ends up in a different time zone, like in a different timeline, 200 years from her current time. And then the story unfolds from there. It's a very interesting show. I would highly recommend it.
Thank you for the recommendation, Neha.
Not safe for children though.
Yeah, okay. I'm glad you clarified that. How we do have to clarify that, Ajkal, especially in streaming world. So I have three recommendations. One is a book. I may have said it before. If I haven't, I'm going to repeat it. It's a biography of Rakesh Maria, who probably the one man who's seen two of the deadliest terrorist attacks that happened in India, the 1993 Mumbai blasts and 26/11/2008. Read it. Of course, read it with a pinch of salt, but do read it. It's a very interesting account. The second show is starring a guy that played Rakesh Maria in a movie called Black Friday. That guy is KK Menon. He
Okay.
played the character of Rakesh Maria in Anurag Kashyap's wonderful movie Black Friday. But this one is a show called Special Ops. It's Mohal Joshi last week recommended it. I happened to see it. It's espionage. It's a lot of fun. And the third
Where
recommendation
is it?
is on Hotstar.
Okay.
ये कोई हमें पैसे नहीं देता by the way platforms बोलने के लिए we have no sponsors so we can just say all. So if you want to sponsor and want us to recommend your show, shamelessly tell us. I'm kidding, no, we don't do that. But no, we don't do that. And my third recommendation is a show called Ozark on Netflix. It's a terrific
Oh,
show.
I saw that season 3 yesterday.
Season just dropped out last weekend, so watch it. Don't tell me that you don't have time. You have a lot of time. And I want to leave you guys with two very funny things I've seen. One by a bunch of cops, one by Chennai cop. I think he was wearing a helmet like a coronavirus shaped thing. CNN carried that shit, and it was a ingenious idea. Second was a video that I saw where two guys came and then there was this song "Ai Ye Aapka Intezar Tha." The cops were doing it with an आरती की थाली और यहाँ पे फूल लगा के, I mean, they were looking embarrassed, and it was a very beautiful. It was almost like a Rajkumari Hirani-esque way, or Rishikesh Mukherjee.
There was another one today. This morning, I saw this one guy who kept prank calling on one of the helpline numbers, which have been given out for food distribution. So if you're out of food, you're supposed to call that number, and they would bring you some rations. This guy kept calling and ordering samosas. So eventually, the cops reached there, took him out, and make him clean the nali.
So those are the.
And then they gave him samosas.
Okay, then they did give him samosas. Okay, so we live in very dangerous times. There is sort of a gloom that has descended over the world, but we wanted to leave you guys with a bit of a smile, because ultimately we have to keep our spirits up and pray that we limit the casualties wherever they are. So stay safe, people. Thank you so much, Neha, for joining. It was a pleasure.
Absolutely.
Please write to us with whatever you think, if we completely rocked it or we did not. So we'll be back next week with more, maybe sooner than next week, who knows. We're working from home, might as well do more podcasts when we do get a chance. So take care, guys, and we'll be back soon. Thank you.